Let's talk about Achilles tendonitis and Achilles tendinosis. I'm Dr. David, orthopedic surgeon, sports medicine specialist, and author of That's Gotta Hurt, The Injuries That Changed Sports Forever. I provide education, information, and commentary on all sorts of sports and exercise injuries, injury treatments, and injury prevention for athletes and active people so that you can stay healthy and perform your best. I've actually had Achilles tendonitis, and I'll tell you, it was miserable. I had it for a couple weeks, and it drove me bananas. I was working as the doctor of a professional tennis tournament when it flared up, so I was always having to walk from the clubhouse to center court or some of the surrounding courts, and sometimes you had to get there really fast to see an injured player, and it just drove me bananas. And it started to where I'd take one step and I'd get this pain in my Achilles tendon. So if you have it, I know how uncomfortable it can be. What we're talking about is an inflammation of the tendon on the back of your heel. Connects your calf muscle to your heel bone. And you see it a lot in runners and really active people, but you can see it in less active people as well. It can be an inflammation of the tendon or the sheath around the tendon and can be really aggravating. But it can actually also become tendinosis, where you get a small area of degeneration. Some people also call it tendinopathy, but a small area of degeneration in the tendon that can be even more painful and even harder to get over. Now, when you go to the doctor, they can usually figure it out by history, basically you talking about your symptoms, and physical exam. Sometimes they might get x-rays. Typically, you don't need an MRI unless you're just not getting better with some of the traditional treatments. Now, here's kind of what we talk about as far as ways to try to get better. We think that ice can be really helpful, trying to calm down that area of inflammation. You can try anti-inflammatories, may or may not help a whole lot. Ice and anti-inflammatories, though, might be good places to start. There's some stretching exercises you can do. We also think that eccentric strengthening of the calf muscles can be good. Basically, the negative. So imagine if you're standing on some stairs and you slowly, with basically your toes hanging over the edge, you slowly lower your body and then kind of push up quickly. It's that slow lowering phase, basically holding your body weight and let it descend slowly, the eccentric, that can be really helpful. I think it's really helpful to work with a physical therapist. They can do strengthening exercises, stretching exercises, but even try modalities like PRP, or not PRP, but like ultrasound, and see if that helps. Now, if it does turn into something like tendinosis, you certainly start with all of those kinds of things, but sometimes then you're thinking about things like PRP, platelet-rich plasma injections. Occasionally, tendinosis or tendinopathy can involve so much of the tendon that if nothing else is working and it keeps hurting, sometimes surgery is actually necessary to cut out the diseased portion of the tendon and either sew it back together or actually reconstruct the Achilles tendon. So definitely, if it's been bothering you more than a week or two, go see a physical therapist or go see a sports medicine doctor, find out what's going on and some steps to get over it. Have you dealt with Achilles tendonitis or tendinosis or tendinopathy? How did you find out what the diagnosis was? And what did your doctor suggest to get over it? How did you recover from it? I'd love to hear your experience. I can't answer specific medical questions about it, but I'd love to hear your experience. So in the comments below this video, describe your injury, your Achilles problem, and what it took to get over it. Now, I'd like to help basically understand your injury. I want to know really the biggest challenge you have with your injury. In the description below this video, there's a link that'll take you to a page on my site where you can write as much as you want describing exactly your injury and the biggest challenges with it, so that I can design content, videos, even courses that basically, by knowing what you're dealing with, I can create content that helps you and helps everybody that's dealing with sports or exercise injuries. So go to it's the very first link in the description. All right, if you like videos like this, you want more information on sports and exercise injuries, injury treatments, injury prevention, subscribe to my video channel. I record several of these videos every single week, plus occasional live videos where you can comment and ask questions, but you won't know about any of those, or you won't get them delivered to you unless you subscribe. So click the subscribe button in the upper right corner of the page. Thank you so much for watching. I hope if you have Achilles tendonitis, this video is helpful, and I look forward to seeing you right here next time.